I hope you can hear me fine behind. It's okay? Yeah. So welcome to the Music Cognition Symposium, and I'm really glad to see that people have come not only from outside of IIIT but from outside of Hyderabad as well, and actually one outside of India as well. So I'm really happy to see this turnout, and of course I guess people will come in slowly. So before I start my presentation, let me just introduce myself once more. I'm Dr. Venu Alluri. So I joined the Cognitive Science Lab at IIIT last year in June, and I've just moved back from working in Europe. So it's been almost 10 years since I've started working with my wonderful former colleagues from University of Jyväskylä in Finland. So, and I continue to work with them, and it's been pretty exciting and rewarding, and I'm very happy that they've come all the way here, and I thank the Academy of Finland and University of Jyväskylä for allowing this event to happen here. So just a bit of a background. Well, first of all, why is it happening in IIIT? Because, well, they employed me partially because I had an engineering background, I suppose. So, but then I'm very glad that there is an opportunity to do some music research here, because I think that's really lacking not only here but in India. So this symposium is basically just to give you a flavor of what happens in music research and what we could hopefully do here, and we're hoping that bigger things and better things will come in the forms of maybe a larger conference or a much larger symposium. So we just hope that we can extend this and not just stop here. So I thank you once again, and I hope that you have an intellectually stimulating 2 days for the symposium. So I'm just going to talk more about what this fuss about music research is. So, okay. So just before I go into more information, I just want to share a couple of anecdotes. So for me, music has played it's been a very important part of my life, starting from childhood, where there were instances where I remember having some low-grade fever, nothing special, everyone gets that, right? So, but I remember that when I put on, some music, I was all up and ready to dance, right? So, so I thought, okay, this is helping me, so it works for me. But then I noticed another thing. My cousin, well, she passed away when she was 15, but she was diagnosed with, it was not cerebral palsy, but totally mental retardation, or literally it was almost like a stop of growth. So she just grew physically, but mentally she was like a month-old baby, right? So she lived for 15 years like that. So obviously she couldn't communicate, and there were many times where she was in great pain, but we would not know what to do because she would be 13, she's in great pain, we wouldn't know what to do. But my aunt noticed that when she would put on some music, she would stop. And it's not all music, but preferably music without lyrics. So I don't know what it was. So for a person, or for a child who cannot recognize anything, who cannot really, the brain hasn't developed much. But despite that, there is some very profound effect that alleviates her pain. So I found that to be extremely magical, because it's just not me, but it's also her, someone whose brain has not developed at all. So there must be something extremely fundamental and something very deep that music, some sort of a deep impact that music has on us. So that's why I sort of believe that music is in fact the strongest form of magic, maybe even the strangest form of magic, because it's so abstract. We don't know how it, it just comes from nowhere. Like, I mean, not from nowhere, from the singer or the musician or the speaker, but still, it's just such an abstract stimulus. But then we go through such a range of emotions. We go through so many different states of mind when listening. So, yeah. So that's just a bit about how music has impacted me, and hence I moved into research in that area. So first of all, why would we study music? Yes, we all know that it impacts us, it makes us feel good, it relaxes, relaxes us, we know all that. But if you go back to, look into history, so from, let's say from an archaeological point of view, the earliest instruments found were dated to 42 or 43,000 BC. So there was an argument whether they were, they were actually those flutes, or it just happened to be puncture wounds on an animal's bone. But maybe, the Neanderthals stumbled upon it, and maybe you blow through it and then you get a sound. So there is that debate though, but still people do believe that they were actually flutes from about 42,000 BC. And also starting from infant directed speech, right? So as you know that when mothers speak to their children, mothers or fathers, they, of course, it's more like singing. There is some sort of a pitch contour. So if you want to convey your emotional states or your feelings, how would you do that with a child when they don't understand language to begin with, right? So what you're left with is something which is more pitch and rhythm oriented. So in that sense, there are people who also believe that music predated speech. The speech processing people won't like it probably, but yeah, so there is also that aspect to it. And also when you think about groups and these tribes that have music, right? So it does promote group cohesion, social bonding. So in that sense, music in some ways a form of social communication. And if there is greater group cohesion from an evolutionary point of view, there is a higher chance for survival of that particular group or species. So, but that is in the very, very olden days. But now music has taken new forms, right? So it has become a leisurely activity. You can enjoy it all alone by yourself. Right? Earlier music was a group thing. Someone had to make music, someone had to listen to it. There was a group oriented activity. But now it has become a way in which you can create your own personalized space. You have all your iPods, you have all these where you can actually literally create your own space, and then but still it does continue to be a vehicle for cultural and social identity. So just to cover some emotional effects of listening to music from the research point of view. So it does evoke a subjective experience with physiological reactions, which typically involve changes in heart rate, respiration rates, skin conductance, hormone secretion. So when we say hormone secretion, it's related to decreased cortisol levels, cortisol levels are related to anxiety and stress. So decreased cortisol levels means that yes, there is a reduction of your stress levels, and increased oxytocin and beta endorphins, which are, let's say, your happy hormones. So in that sense that it does have several beneficial emotional effects. And of course there's been a lot of research done by Professor Suvi Sarikalia about how music is used for mood regulation, and it often induces a positive mood. So she would be talking more about that during her talk. And there was also this very interesting study which showed that the pleasure that is experienced when listening to music is associated with dopamine activity in the mesolimbic reward system. And this reward system is the same system that sort of reacts to the pleasure or that we get from basic things that we need, like food and sex. Drugs are not basic, they're not basic at all, but even drugs act on the same system. But so just to give you an idea that yes, music does activate the same reward systems which have been a core for human evolution as well. Now, there's some studies which talk about how participating in, for example, singing, it showed that it increased social bonding and improved emotional communication, and also help pro-social behavior, and typically in kids as well. So when you do, especially singing, so that's you must have noticed that when we play this Antakshari, as families, I don't know, nowadays people don't play that anymore, I suppose, but Antakshari, just for the international speakers who don't know, it's a game where you start singing a song, you're in groups, and then you whatever phoneme or you end with, the next team has to start singing a song with that. So it's like a group thing where you have to quickly do that. You have some time, but we used to play that like when we were kids. So it was a fun game. Okay, so just to give you an idea of what happens in the brain, or what can we predict when we play a piece of music, we extract some musical features, and then we want to see what's happening in the brain. Can we predict the activity? So this was from one of our earlier studies. So this is an animation which will show you how the activation changes in areas based on the music. So as you can see, the auditory cortex is there on the end. So with this method, we can really predict very well what happens in the auditory cortices. So as we can see from this, it's not just the auditory cortices, right, that one would expect to be activated while listening to music. There are so many other elements to music. There's the syntactical element, there's the semantic element, these associations, prior memories that we attach to a particular piece of music that we listen to. So there are several networks in the brain that would be involved in processing music and be active at different times during the music as well. Okay, so just to move on to okay, so music listening, yeah, it has all these effects from the emotional point of view, but what about the cognitive effects, right? So there were these series of studies that came out saying that listening to Mozart for some 10 minutes a day will improve your math, your reading and all that. So there were a bunch of studies which had come out during a decade, and then they did show that people who did listen to that, typically on students, they had performed it, that they got better at psychomotoric or cognitive speed related tasks, or decision making which was related to abstract thinking and resolving a puzzle, and then attention and working memory as well, and creativity. So of course one can question why Mozart, right? I mean, we don't listen to Mozart here as much, and maybe most people don't even care. But this one study did say that there is no merit to the claim of a link between listening to music composed by Mozart to the exclusion of music by other composers. So it's not just Mozart, maybe you should have tested other composers, other kind of music. So it's just that maybe you better, when you're listening to music, then you probably focus and you tune everything else out. So maybe that just helps in that sense. So I would say this is fiction anyway, but of course, the studies did show these results. So it's not really just Mozart, it could be any other kind of music as well. So let's move on from music listening to musical training. So there are several effects of musical training, and that can manifest in structuring the structure and functioning of the brain. So when I say the structure, it's like the anatomical structure in your brain, and functioning is related to how your brain processes things, right? So in one sense, I'll show you a few examples of how the structure does change and how the functioning also changes. So in one sense, musical training is a nice, it's a very convenient tool to investigate brain plasticity, right? So because as you keep playing, it's not when you're a kid that if you play a musical instrument, you get better at many things, but even at a later age, even when you're 60, 70 years old, by playing a musical instrument, they have shown that there have been improvements in cognitive abilities. I'll show you a few examples of that. So there's been a lot of research that says that musical training enhances auditory, motor and cognitive skills, and it leads to increased gray and white matter volume in brain areas associated with these skills. So just to give you an example, so these are, this is from this study where what you see on top is of an 8-year-old boy. I mean, both, it's two 8-year-old boys, and one received no training and the other received musical training for a span of 2 years. Okay, and what you see after is how the structure develops. So you see that in the bottom that they have the arcuate fasciculus, which basically connects the speech related areas and so the auditory and also a part of the motor areas as well. So speech production, speech comprehension and the motor areas. So there is a thickening of the white matter as well. So this does show that so there will be structural changes. So this is for an 8-year-old, but if you look at musicians who have been playing for many years, so you see that a 65-year-old musician versus a non-musician, you do see that there are such structural differences as well. And like I had mentioned before, piano instruction enhances executive functioning in older musically naive adults. So they did a study where they trained adults from 60 to 85 years, and they did see that they performed better even at that age. And they also found that playing an instrument was associated with decreased risk of dementia. I mean, if you think about it, playing a musical instrument requires so many things to happen at the same time at such a fast pace you're really exercising your brain, right? So it's like very good mental exercise. So, and if it's rewarding, even better, right? So that way it's not surprising that getting involved playing, playing an instrument also does, help the older generation, and it has many long-term benefits, if not short-term. Okay, so there are several transfer effects to musical training. So they found that children who did go through musical training had better spatial skills, reading skills, ability to detect phonemes, and the general IQ in children with musical training was higher. So they did better on so many things. And recently in The Guardian last year in October, so there was this article about how, this school in UK, I think in Bradford, where they showed that the SAT scores of theirs in music and English, and they improved drastically. And what they did find is that they had started teaching music in schools. It was part of the curriculum, so they were learning through that, and they had at least 6 hours of musical training per week. Musical involvement, let's say, not musical training, but they were learning by playing musical games. So they did find that reading, writing and math scores were very good, and they had improved drastically. But there was another longitudinal study which was done, it was published in 2014, this was done in China, and they did find that yes, overall children did better when they did receive musical training. They did well in languages, in math, and overall academic performance was better. But the only significant difference they found was in their second language. For them, the second language was English, and they found that they picked it up much faster. They did better in that because musical training was introduced. Okay. So I just try to touch upon this, that okay, so listening to music is good, playing an instrument is good, so okay, that justifies why we want to do music research as well, right? So what does music research really entail? So what are the different dimensions to it? So there's one where you're trying to look into the perception of music, the musical experience, and then you want to look at how individual differences play a role, because each person reacts to the same piece of music in different ways on different days. And then you also have the computational part where you want to extract, you want to look at the music as a signal, an acoustic signal, extract features, and do more analysis on that to try and understand how that relates to what we perceive. And of course, there's also on music education, what would be the best way to actually train musicians as well. And there's of course music and movement, which is related to how we move to music, how we dance, how we produce music, how do those movements and gestures affect our either production of music or perception of music. And then there's also the social context, right? So we also have how different age groups, or from a cross-cultural point of view, which is again highly lacking, right? Because there's not much work coming out of India on that front. So how how does the cultural context, how that affects or modulates music perception and cognition? Then of course you have this entire field of tagging and sharing music, and how do people actually consume music, how do they share music, what does it tell about their their personalities, and of course there's music in rehabilitation, so musical interventions, how they help in several different kinds of neurodegenerative diseases or other diseases of other diseases such as cardiovascular diseases and such. So as I said, there's so many facets to it. So obviously there would be people from various backgrounds coming in to do research, and in fact here we have people from the speakers themselves have we have a physicist, we have a musician, we have a psychiatrist, psychologist, musicologist, musicologist, education, so we, and me engineering, but then, and Professor Preeti Rao is not here, but and then it's not only just this, I'm sure I would have missed some of the disciplines, but there's more to it, and also the people who attended the conference. So I have people from, you have engineering students, you have non-academic professionals, you have an AI research scientist, and you have so many people, and I'm very glad that more than 50% of the registrants were not musicians, because we assume only if you're a musician you would get into music research, but I'm just that's not the case here, so that's good. Okay. So now, so why here? I want to address two questions now. Why music research here, and why now? Because that's why you're here for that. So why here? Let's talk about why in India, right? So why do we need to do it here? Because first, it's dominated by research from the West. Australia is not in the West, but let's turn the map around and say it's far West. So it's, we don't have much coming out of here. And so then we question how far is it generalizable for us, right? So because whenever I show some of my slides on the, the neuroscience and the acoustic features, they said, how would they react to Indian music? How would they react to Indian ragas? Well, I don't know. We never did it. I was in Finland, and my co-supervisor, then she decided. I mean, we decided actually. So yeah. So yeah, maybe it's time that we do something here now and understand how can we improve the cognitive neuroscience of music here. And why in IIIT, right? So why here? Why not in some other humanities, or maybe neurological institute or somewhere else? Well, first of all, since there's been a surge of there's been this surge of studies in neuroscience, and then people use a lot of music information retrieval, which is related to computational analysis of music, computational modeling. So all these in conjunction with neuroscience, and neuroscience now everyone seems to be doing all sorts of fancy things to these deep learning. I don't have to say anything. I just have to say deep learning, and most of them understand. Yeah, it's about predicting, classifying anything, whatever, and the brain, we use brain data to classify this. So they go on, they keep talking about that all the time here, I've realized. But why not we do it in the context of music? Because maybe you're actually, we know more, and probably that helps society eventually. So I think that being here in an engineering institute is like a very good marriage. So I think there's a lot we can do. And just to illustrate what we have done and what we are doing here at IIIT. So there were a couple of studies that we did last semester, and actually Anant and Sharat are here. So we did these studies. I think Suvi will elaborate a bit on them because it follows up her work. So this mainly relates to your proneness to depression and the way you associate with music. So it's not what kind of music you listen to, so don't confuse that, but how we associate with music and how that might be indicative of some underlying behavioral issues. So we sort of try to work on that here. She will talk about it, so I won't go into details here. And luckily it got, not luckily, I mean you did a good job, so it got accepted at the International Conference on Music Perception and Cognition as posters. And the work in progress right now is primarily in the field of neuroscience here and music. So there's one student, Nishant, who's working on deep learning to classify musicians and non-musicians. So just looking at their brain responses to music, he's trying to classify using deep learning. And then there is another student, Dipankar, who's working on multimodal fusion. He hasn't got there yet, but he's trying to understand the entire field at the moment. So to understand how you can combine neuroimaging data, behavioral data, to actually get an entire understanding of musical aptitude. And then there is another student, Rohan, who's working on how to dynamically decode emotional states while listening to music. Because when we say that, okay, this music sounds pleasant to me, there would be points where it might not sound as pleasant. So it's a dynamic thing, right? So he's trying to look at that. So that's why here. Now why now? Why do we need to do music research now in India, right? So according to the World Health Organization reports, depression is the leading cause of ill health and disability worldwide, and it's about 322 million people are now living with depression, and that's only between 2005 and 2015 there was this increase, so now it's even more. And not only in depression, but ranging from dementia to autism to diabetes. And then of course diabetic people are at a higher risk of getting a stroke as well. So so there's a lot of work, there's a lot of disease, let's just say that there's lots which is not good happening at the moment health wise. So I thought, let me just show you what studies have been done in the field of music therapy. So there's this Cochrane library which sort of gives you an overview of the studies that have been done in music therapy. So if you can look at the illness and condition, you notice that the kind of illnesses you see are cancer, mechanically ventilated patients, brain injury, preoperative anxiety, heart disease, pain relief. So most of them you see the outcome is if you use some sort of musical intervention, then there is reduced anxiety, reduced pain, and in some cases there is also reduced intake of analgesics, because the pain level also seems lower, so they can tolerate that as well. So N gives you the total number of studies. So they do some sort of meta-analysis to get an idea of what the outcomes are. So not only in such conditions, but in neurodegenerative disease as well. So you have schizophrenia, insomnia, depression, dementia, ASD. So overall, it shows that it reduces anxiety, it improves, it reduces depressive symptoms, and it improves global state, or it promotes well-being. So this shows that it's picking up. So some form of musical intervention seems to be quite useful. I think Professor Shantala will be talking more about musical interventions in her talk. But just to give you an idea, right? So this is I'll play both the videos, but this is of a stroke victim. When you have a stroke, then there is it's highly likely that you develop aphasia, which is related to you cannot produce speech. But with a lot of therapy, sometimes they do regain. But this is how music therapy or musical intervention